do for us. The next talk is the overview of vascular EDS, and we're including in that talk today some principles on managing other medical conditions in individuals who have vascular EDS. And the talk will be given today by Emily, who is our registrar in Sheffield at the moment. Thank you, Emily.
Hi everyone, thanks very much. My name's Emily Woods. I'm one of the registrars in clinical genetics in Sheffield, and I'm currently working with the EDS service in Sheffield. I appreciate it's Dr. Diana Johnson on the programme, but unfortunately she couldn't be here today. I also realise that I'm talking to an expert audience, so I'm sure a lot of this will be very helpful. So I'm going to give an overview of vascular EDS and also talk about the management of other medical conditions in vascular EDS. So as we all know, vascular EDS is a rare type of EDS. It's a connective tissue condition, and it's caused by a gene alteration in COL3A1, as Duncan has just nicely described. It leads to an altered type 3 collagen protein, which in turn leads to disordered packing of collagen fibres, making connective tissues essentially less effective. And this particularly affects the blood vessels, hollow organs, mainly the bowel and the skin. As I'm sure you all know, some of the common features include tendency to easy bruising or exaggerated bruising, thinner skin, and visible blood vessels, particularly on the upper chest or the legs. These might be more tortuous in nature. Other features can be very variable, even between individuals within the same family, but we know that some of these might include hypermobility of fingers and toes, premature aging of the skin on the hands and feet, subtle facial features including prominent eyes or attached earlobes, for example, and early onset varicose veins, so earlier than what we might expect in the general population, and not associated necessarily with pregnancy. It's recognised that the diagnosis is often made in the first person in the family following a significant event. And evidence shows that having a diagnosis made early with appropriate clinical management and long-term follow-up actually improves outcomes for individuals with vascular EDS. There might be some early clues for someone earlier on in life, such as amniotic band sequence, prematurity, or severe talipes, which is a congenital clubfoot, as you can see in the picture on the right. Or other distal contractures. So contractures essentially means a fixed positioning of a joint, and as we can see there, that's a fixed positioning of one of the finger joints. So interestingly, we've seen some of these early clinical clues in our Sheffield cohort, but these currently aren't part of the 2017 diagnostic criteria for vascular EDS. So as part of the Road to 2026, these and other features will be looked at in terms of putting forward potential update to the diagnostic criteria. So I'm going to talk a little bit about some of the blood vessel complications, and again I'm sure this is all quite familiar with everybody. As you can see on the left there's a diagram of an artery, and arteries are made up of 3 layers. So the inner lining, the middle bit, the media, and then the outer lining. One complication seen in vascular EDS might include aneurysm, and an aneurysm is essentially a swelling with all 3 layers of the artery intact. And it's where the artery wall has essentially ballooned out a little bit, which can potentially cause a weak point in the vessel. Just below that, the diagram below, it is sort of a visualisation of arterial dissection, and this is where you can get a tiny tear in the inner lining of the artery, which can cause blood to leak out between the outer layers. Any symptoms of a dissection might depend on the location and extent of the tear, but sometimes it can cause pain or compromise to certain parts of the body, depending on where it is. And lastly, as we know, spontaneous arterial rupture is another complication. So in terms of what we do, in terms of the vessel management recommendations, everybody who is known to the Sheffield or London EDS services are managed via the Inherited Cardiac Conditions Clinic, so the ICC. In the ICC, blood pressure is checked regularly, and treatment with medication is often initiated. Treatment with medication has been shown to be effective at reducing the risk of vessel events. There's also screening with monitoring of arteries with MRI scans, which are scans which don't give radiation, unlike other types of scans like X-rays and CT scans. And then follow-up is in the joint cardiology and EDS clinic. Just to mention some of the other possible complications that we can sometimes see in vascular EDS. One of those is the increased chance of hollow organ rupture, and what we're talking about mainly is bowel. The uterine is often rarer and more so associated with pregnancy. But just to talk through that graph on the right there, so along the bottom axis are the ages at which individuals have had spontaneous bowel perforation, and the y-axis, so the vertical axis, shows the incidence, how many people have had a perforation at that age. So you can see that there's a cluster there in sort of the mid-teens and again in the early to mid-20s. It can happen at any age, and there are some people who've had spontaneous bowel perforation a little bit later on in life, but it is more common at those two sort of peak ages. I'm sure, as you all know, there's also an increased chance of a collapsed lung, which is a pneumothorax. So just moving on now to unrelated medical conditions. So, of course, people with vascular EDS can have other unrelated medical conditions, and generally treatment for these other medical conditions can often be a standard for that condition, but sometimes there does need to be modification. Consideration of the vascular EDS diagnosis must be given when thinking about investigations and management. And management sometimes needs to be modified to avoid invasive procedures where there are other options available. So I'll go on to give some examples here. So we know that the fragility of tissues seen in vascular EDS can mean that there's a higher chance of complication. So invasive procedures should be avoided if at all possible. Of course, that's not always possible. So it really does depend on the indication for the procedure. The sort of invasive procedures we're talking about are things like angiography, enemas, endoscopy, so camera tests such as colonoscopy. But of course, if there is an alternative available. So in some circumstances, it might be that having a scan, a non-invasive scan, is just as suitable as having an invasive camera test, but it would really depend on the individual circumstance. The use of non-invasive techniques can avoid stress and tension on the skin, organs and vessels, and so the reasoning is to reduce the chance of complications. There are some circumstances where anticoagulation therapy is indicated. For example, if somebody has had blood clots, this should only be started after consultation with local haematology specialists. And in terms of sort of wounds or dressings, we would always advise the gentle removal of dressings and tape to help avoid injury to the skin. So just moving on a little bit to talk about surgery. We do know that the surgical risks are greater in individuals with vascular EDS, and of course the diagnosis needs to be considered in any planning of management. In general, conservative options are preferred if possible, so if there are alternatives to having surgery, then those would be preferential. But of course that can't always happen in some cases. In some surgical cases, it's appropriate for a vascular surgeon to be present in the theatre case, but that really depends on the surgery. And in terms of dental surgery, so dental extraction is quite a fairly common procedure, and we would always recommend that extra precautions are taken, and in particular that these really ought to be carried out at a dental hospital as opposed to a local dental practice setting, purely for the purposes of sort of managing complications. So I'm sure everybody is very well aware that we do encourage people to self-advocate, and we always encourage people to have their vascular EDS information with them. The picture on the right is a little bit blurry, but it's the information that we give to individuals in our Sheffield clinic, which provides a summary of information that they can pass on to medical professionals in any medical or health setting. And the point of this really is to help them to help you, because some people are not necessarily familiar with the condition, so it's very important to self-advocate. This is a photograph of the pack that Annabelle's Challenge provide, which can be extremely useful in sort of collating all of the information about your own medical care, and including that emergency information as well. Again, the picture on the left there is the emergency information we provide to the individuals seen in the Sheffield service, which provides emergency information for medical professionals, which talks about concerning presenting symptoms, management guidance, advice regarding emergency surgery, and signs and symptoms that require medical attention, things to look out for. Similarly, the condensed version of that is in the form of the wallet card, which is there on the right, which we hope that you will have available if ever needed. So in terms of pregnancy, for women with vascular EDS, we know that there are a number of additional considerations in pregnancy and at delivery. I'm not going to talk about that in any detail right now, but there is a breakout session at 2 o'clock if anybody wants to find out more. So this is just a little summary slide. So the NHS EDS services, as we've heard, as we all know, are in Sheffield and London, and those services can have discussions with other health professionals from other teams when needed, regarding any other medical condition that may or may not be related. The teams can be involved in conversations regarding planning or management of certain conditions, and the teams can be involved in providing information and advice about vascular EDS to other health professionals if ever required. So thank you very much for listening.